Just published June 25th, 2025, the American Society for Radiation Oncology's newest guideline on radiation therapy for World Health Organization, also known as WHO, Grade 4 Adult-Type Diffuse Glioma. The objective of this guideline is to provide evidence-based recommendations for the multidisciplinary management of these tumors, focusing on diagnosis, initial treatment, reirradiation, and health disparities, while acknowledging that present literature primarily represents historical histological grade 4 glioblastoma. There are 17 recommendations, so let's get started. For patients with WHO grade 4 diffuse glioma, fractionated radiation therapy, also known as RT, after biopsy or resection is recommended. For patients with WHO grade 4 diffuse glioma who have undergone biopsy or resection, concurrent temozolomide, also known as TMZ, with RT, followed by adjuvant TMZ is recommended. For patients with supratentorial WHO grade 4 diffuse glioma who have undergone biopsy or resection and concurrent chemoradiation with TMZ, alternating electric field therapy for greater than or equal to 18 hours per day starting during adjuvant TMZ is conditionally recommended. For patients less than 70 years of age and Karnofsky performance status, or KPS, of greater than or equal to 60 with WHO grade 4 diffuse glioma who have undergone biopsy or resection, partial brain irradiation with 6,000 centigrade in 30 fractions with concurrent and adjuvant TMZ is recommended. For patients older than or equal to 70 years of age and a KPS of greater than or equal to 50 with WHO grade 4 diffuse glioma who have undergone biopsy or resection, partial brain irradiation with 4,005 centigrade in 15 fractions with concurrent and adjuvant TMZ is conditionally recommended. For patients with WHO grade 4 diffuse glioma who are frail and have undergone biopsy or resection, partial brain irradiation alone using 3,400 centigrade in 10 fractions or 2,500 centigrade in 5 fractions is conditionally recommended. For patients with WHO grade 4 diffuse glioma who are very frail or with a KPS of less than or equal to 40, supportive care in lieu of RT and or systemic therapy is conditionally recommended. For patients with WHO grade 4 diffuse glioma, intensity modulated radiation therapy is recommended over 3D conformal radiation therapy to reduce toxicity. For patients with WHO grade 4 diffuse glioma, the following target volumes defined by MRI are recommended if cone down/boost is desired. GTV1 equals resection cavity, residual enhancement on postoperative T1 post-contrast, and T2/FLA-IR changes. GTV2 equals resection cavity and residual enhancement on postoperative T1 post-contrast. CTV1/2 equals GTV1/2 plus 10 to 20 millimeter expansion modified to respect natural barriers to tumor spread. PTV1/2 equals CTV1/2 plus 3 to 5 millimeter expansion. For patients with WHO grade 4 diffuse glioma, the following target volumes defined by MRI are recommended if no cone down/boost is desired. GTV equals resection cavity and residual enhancement on T1 post-contrast. CTV equals GTV plus 10 to 20 millimeter expansion with additional expansion as needed to include T2/FLA-IR signal changes, modified to respect natural barriers to tumor spread. PTV equals CTV plus 3 to 5 millimeter expansion. For patients with WHO grade 4 diffuse glioma, a volumetric brain MRI with and without contrast, preferably less than or equal to 14 days before starting RT, is recommended for treatment planning. For patients with WHO grade 4 diffuse glioma receiving RT, daily image guidance is recommended to facilitate reduced CTV to PTV expansions. For patients with suspected recurrent WHO grade 4 diffuse glioma, establishing the diagnosis by pathology or advanced imaging is conditionally recommended. For patients with recurrent WHO grade 4 diffuse glioma with a KPS of greater than or equal to 70, in-field RT interval of greater than or equal to 6 months, and or focal tumor volume of less than or equal to 6 cubic centimeters, reirradiation is conditionally recommended following a multidisciplinary patient-centered discussion. For patients with recurrent WHO grade 4 diffuse glioma who elect reirradiation, the following treatment options are conditionally recommended: conventionally fractionated RT, hypofractionated RT, stereotactic radiosurgery, fractionated stereotactic RT, or brachytherapy. For patients with recurrent WHO grade 4 diffuse glioma who elect reirradiation using a GTV defined as contrast-enhancing tumor, non-enhancing tumor, and or resection cavity based on MRI is conditionally recommended. For patients receiving reirradiation for recurrent WHO grade 4 diffuse glioma, concomitant bevacizumab is conditionally recommended to reduce toxicity. And there you have it. Make sure to check out the full guideline from the American Society for Radiation Oncology and other related clinical decision support tools at guidelinecentral.com.